At any time in your investigation, you can click the SOAP button to enter SOAP notes. You can type into the following categories: subjective data, objective data, assessment data, and plan. You may also copy and paste text into these fields. For example, you might copy and paste in a significant lab test result into the objective data field. Click the Save button to preserve your entries, or click View Printable to print your entries. When you click the Diagnosis button, you will first be prompted to enter interpretations for any items that you haven't yet interpreted. Then you must review and update your SOAP notes as needed. Click Done to go to the Diagnosis window. You must have at least one active hypothesis to enter a final diagnosis. In the first field, select the hypothesis or hypotheses upon which you will base your final diagnosis. Click Select. In the second field, expand on or edit your hypothesis text into a complete but concise diagnosis expressed in pathophysiological terms. In the third field, list the data from the patient history, physical exam, and lab findings that support your final diagnosis. In the fourth section of the diagnosis window, select a rating that best describes your level of confidence in your diagnosis. Click Enter Final Diagnosis when you are done. Once you enter a final diagnosis, you will no longer have access to the interview, exam, or lab sections of the case. Your problem list should be a prioritized list of the past, current, and potential patient medical problems that should be considered in patient management. You can click Problem List to create a problem list at any time during your clinical investigation, but you'll be prompted to review and, if needed, update your problem list after you enter your final diagnosis. In the field labeled Enter a New Problem, type in a patient problem and click Add. Your new problem will appear in the field labeled Your List of Problems. To arrange the patient problems in priority order, click a problem in the list and then click up or down to change its position in the list. Click Delete to remove an item from the list. Click View Printable to print your problem list. Click Save to preserve your changes.